Now let's talk about the respiratory volume and capacity. This is talking about the amount of air that can get into the lungs. And you'll be surprised that we will have several ways of, or several categories of this volume. We'll have the first one is the tidal volume. And the tidal volume by definition is the amount of air that you inhale and exhale at rest. So the TV is the amount of air you inhale and exhale at rest, like normal breathing. And this is around 500 milliliter of air. So in each breath or each respiratory cycle, we are taking in and out around 500 milliliter of air. Okay, so this is the first one. Now, if you are breathing, if you are inhaling and you stop, you did not exhale. You inhaled and you did not exhale. And then you took another breath. So here, for example, you inhale, you stop, and you took another breath. Deep breath. This will give you the inspiratory reserve volume, the IRV. The IRV is the amount of air forced into lungs above tidal volume, above the tidal volume. What does it mean? If we want to go back to the drawing, so this is the lungs. Let's imagine that this is the lung. Okay, this is the lung. And inhalation and normal breathing, the lung is moving between those two sizes. So the amount of change here is the 500 milliliter. So here, this is when inhale, and this is when we exhale. And when we inhale and exhale, we are expanding our lungs for around 500 milliliter. But now, if we inhale, so if we got into the air here, and then we take another breath without exhale. So now we are starting from this line. Do we take another breath? Like think of a double breath. So now we have the inspiratory reserve volume. This is the amount of air can be forced into lungs after tidal volume. This is the tidal volume. This is the border of the tidal volume. So now I'm taking air into the lungs after the tidal volume. That will be the IRV. Okay? Then there is the expiratory reserve volume. This is the inspiratory reserve volume. And there is the expiratory reserve volume. Which is what? Which is the amount of air that you can forcibly exhale after the tidal volume. Amount of air you can forcibly exhale after the tidal volume. This will be the expiratory reserve volume. This is the amount of air, or ERV, amount of air forced outside lungs after tidal volume, after the tidal volume. Okay, so this is the tidal volume. Again, the red line is the inner tidal volume when we exhale. So there is the expiratory reserve volume. Okay, so this is the ERV. Now inside the lung, this area, this here, still we have gases. So after the ERV, after if you try like to blow air out of your lungs, okay, still there is some air inside your lungs. This air, the leftover air, we call it the residual volume. Residual volume. This is the amount of air remains in lungs at all times. Think of it, this is needed to keep the lungs open. The residual volume. This air, we cannot take it out of our lungs. It's always there. So those are the 4 volumes. We have the tidal volume, the TV. We said this is the amount of air in and out at rest. And we said this is around 500 milliliter of air in healthy individual. Okay? For the inspiratory reserve volume, we're talking about 3000 milliliter of air. Okay? This, we can add to our lungs around 3000 milliliter of air. For the expiratory reserve volume, we're talking about like 1200 milliliter of air. Okay? And for the residual volume, also we're talking about 1200 milliliter of air, always inside our lungs. So those are the volumes. Okay, those are the volumes. 4 volumes. Then we have the capacities. And for the capacities, we have 3 capacities. We have the inspiratory capacity, functional residual capacity, vital capacity, and total lung capacity. Actually 4 capacities. Inspiratory capacity, this is the TV plus the IRV. This is the amount of air that you can inhale from deep breath. So inspiratory capacity includes the tidal volume. So after you inhale, like you stop breathing, inhale, exhale, and then take deep breath, okay, that will be the inspiratory capacity. Functional residual capacity, it's the expiratory reserve volume and plus the RV. So this is FRC, which is ERV plus the RV. What is it? It's the amount of air in lungs, amount of air in lungs at rest. So I think, for example, you are sitting, you are doing nothing. Inside your lungs is the functional residual capacity. You can test that by stop taking any breath and try to blow air out. So there is some air that can come out from your lungs. Technically, that air, if you stop breathing, if you are doing nothing and you stop breathing, you are not taking any air in and then you blow air, that will be the expiratory reserve volume. Then we have the vital capacity, the VC. And the VC is the IRV, the respiratory reserve volume, plus the TV, plus the ERV, which is the vital capacity is the air that can be exchanged, or exchangeable air in the lungs. Exchangeable air in the lungs. Think of it, the air that you have control over. The air you can take in and out. So includes the reserve volumes because you have control over them. But the residual volume, it's always would remain there. So always in your lung, there is around 12 milliliter of air. Not necessarily it's the same air always, but the volume wise, it is there. Then we have the total lung capacity, which is the total amount of air that your lungs can hold. This, if you take deep breath and hold it. So now, if you hold your deep breath, so inside your lung, you have the total lung capacity. Okay? So those are the 4 capacities. Now, why they are important? Because they will give us indications about the health of the lungs. If we have patients that they cannot perform, for example, 500 milliliter of their tidal volume, or they cannot take the 3000, or they cannot expel 1200. Okay, so all of those will be indicators about the functionality of the lungs. And also based on them, we can calculate the respiratory rate, which is the total number of breaths or respiratory cycles that occur each minute. And then based on this and based on those volumes, we will have the minute ventilation rate, which is the total amount of gas that flows in and out of the respiratory tract in 1 minute. So you will count how many breaths, and then you will count what volume, what is the tidal volume, multiply them together, and you will get the minute ventilation rate. However, the problem with this minute ventilation rate is talking about the respiratory tract. So this is talking about the nose, okay, the amount of air that passing through the nose. Now, if you remember from the nose all the way to the alveolus, this is the conducting zone. So there is no gas exchange there. So this rate includes the dead area that, there is no gas exchange. If I want to measure the functionality of the lungs, I should measure the gas exchange rate. Therefore, they came up with something called alveolar ventilation rate, which is the flow of gases in and out of the alveoli. So now we are measuring how much air that comes into each alveolus. And this air is the one that will get the gas exchange. So this is more accurate measurement of the respiration, the alveolar ventilation rate. More accurate versus minute ventilation. So I'll stop here. In the following video, we'll talk about the gas exchange.